Well, good afternoon, everybody. We have a wonderful opportunity today to update you and highlight you on some of our efforts to procure more PPE for the state of California. Some of the efforts that have been underway for a number of months. We're now here at a warehouse in Sacramento, warehouse we've had as a state asset for years and years, where many of our N95 masks, our surgical and procedural masks, gowns, gloves, sanitation equipment resides. It's one of many warehouses strategically located throughout the state of California. Today I want to update you on some of our efforts around procurement to meet the needs that now have grown to 46 million mask units per month that are currently being utilized, what is referred to as a burn rate. 46 million masks now every single month that are being utilized just in the state of California. So I want to put a perspective as we advance our efforts to procure even more PPE about the magnitude of the utilization to date. But I'd be remiss if I didn't start my remarks by acknowledging the obvious, that today we are reporting here in the state of California data that was collected yesterday. We tested 127,000 individuals yesterday. We tested a cohort that was slightly in excess of the average number of tests we've tested on a daily basis. Yesterday we had 12,807 individuals that were tested positive for COVID-19. 12,807 represents the highest reported number in our state. We also yesterday reported 115 deaths here in the state of California. That number has fluctuated a lot. Earlier in the week, I recognized, we were reconciling just 9 deaths, 9 families whose lives were torn apart because of a loss of a loved one, just 9, and made a point that I want to reinforce today, from 9 to 115, just over the course of a few days, that it's more important, I think, beyond just the magnitude of each individual loss, but in terms of trying to get a sense of the mortality rates here in the state of California, to look at those 7-day averages. And over a 7-day period, we have averaged 90 lives lost. That's compared to about 98 lives in the previous 7 days, but nonetheless 90 lives lost. And so it's just another reminder, if I need to remind anybody, of the magnitude of impact that this virus continues to have. I know there is a drumbeat that is often advanced around this notion that somehow the mortality rate is such that none of us have to necessarily worry about having contracted the disease. That is just simply untrue. The data bears that out, and with that number of 115 just yesterday, it's just another proof point of how deadly this disease continues to be. As it relates to the total number of positives at 12,807 that we are reporting today, putting that in perspective, we've averaged on a 7-day period 9,420. That is up from previous week of roughly 8,300. So you're certainly seeing that trend line continue to increase. More tests, obviously more positives, but nonetheless, positivity rate continues to go up modestly. Our 14-day positivity rate has remained steady at 7.4%. 7.4% positivity rate over a 14-day period here in the state of California. But the 7-day rate is approaching where we were last Monday. You recall last Monday we were at 7.7% over just a 7-day positivity period. We're at 7.6% today. So that is cause of some concern. Each decimal point represents what I would argue is a significant increase in that positivity rate. But 7.4 over a 14-day period, 12,807 reported over the last 24-hour period in terms of total number of positive cases in this state, 115 individuals that lost their lives. And to each and every member of their family, our hearts go out to you, and we have not forgotten how deadly this disease continues to be. The purpose of advancing the presentation today with that cause of concern is also highlighted by the nature of this virus now reaching north of 400,000 positive cases that we've collected here in the state of California. We're a state, again, size of 21 states combined. So it's not surprising now in some respects as we've begun to reopen key sectors of our economy. People continue to mix and people continue to come in contact, close contact with others that may have contracted this disease, that our numbers would start to go up. In total now, the highest in the nation, not highest per capita, not highest in that respect, but nonetheless a sober reminder of why we are taking things as seriously as we are, a sober reminder of why we put in that mask mandate here in the state of California, a reminder of why we modified our opening as it relates to moving activities into outdoor spaces, faith-based activities into outdoor spaces, activities like restaurants, moving them into the outdoors, and why that was important. All in anticipation, looking at these numbers, looking at these trend lines before they were becoming headlines. We moved forward with a new PSA campaign. We move forward with these additional modifications in the 35 now counties that are in our watch list. We just added Butte County to that cohort of counties. 35 of our 58 counties now on the watch list, and why we have additional requirements in those counties in particular. So again, none of these numbers in and of themselves mark a distinction from our approach and strategies. We've been monitoring these numbers very, very closely, of course, since the beginning of this pandemic, when we had one of the first community cases in the nation. That's why we were one of the first to move forward with a stay-at-home order to do our best to mitigate the spike in terms of the increase of this virus so that we can mitigate the spread and also buy time to do exactly what we are talking about here today, and that is to set aside a strategy to address the prospect of a surge in hospital utilization, the need to develop alternative care sites outside of our hospital system to help isolate and quarantine individuals, the ability to build a cohort of over now 10,000 contact tracers in the state to develop a platform to aggregate and share and distribute data related to contact tracing in the state, which we have done, and to move forward to identify key needs as it relates to personnel, part of our health core strategy in this state, where over 96,000 people went to that healthcore.gov site, and 35,000 have availed themselves of their active capacity to have current license registration so that we can begin to pull from that resource base appropriate human capital that may be needed to staff the beds, these alternative care sites, support our efforts in terms of contact tracing and the like. But the purpose of today is to focus on another element of our preparedness and what we've been doing now for many, many months to highlight where we are and where we intend to go over the course of the next few months in terms of procuring PPE. Our PPE strategy has been a success. Our PPE strategy was predicated on the lack of a national strategy, where many had recognized, and California early on recognized, that we were competing not only with other states, but other nations, including the United States, our federal partners themselves, in terms of getting adequate supplies of PPE. Because of the size of the state of California, again, size of 21 state populations combined, the nation's largest state, we could have either lamented that, been frustrated by that, pointing fingers at other partners or the failure of developing partnerships in this space. Rather, we decided to change the game, try to be more resourceful in our mindset in terms of how we approach the issue of procurement of PPE. We announced a number of months ago a very bold strategy to shape PPE procurement not only for the state, but we thought we could accelerate the efforts for this nation by developing new and larger contracts. One of those contracts, not the only one, but one of those contracts was the company called BYD. We made some bold commitments in terms of procuring hundreds of millions of units of surgical procedure masks, as well as the N95 masks. We announced those and that we would maintain a consistent supply chain that would come into the state of California in May and June. And we were able to secure exactly, well, within a margin of what we anticipate, 193 units of surgical masks out of 200 million have already arrived here in the state of California. We have been able to procure roughly 146 million N95 masks. We have 150 million more that will be coming in the next few weeks, so 300 million N95 masks as part of that contract. The anticipation of that contract was in a 90-day period, 60 days for the first tranche. We're within that period, and we're very pleased with the success of that contract and our ability to draw down those assets. There was a little bit of delay with what we referred to as a NIOSH certification for some of the N95 masks, but as I said at the time, delays were not denials, and we were able to work through some of those certification issues with our federal partners, and as a consequence, we were able to procure those assets and those additional units. Why does that matter? You can see some of the masks behind me. It matters for precisely the reason that we worked so aggressively to bend the curve initially. And that was, as we reopen the economy, and we do so in a strategic and phased approach, we needed to maintain a level of safety and confidence for our healthcare workers, our frontline workers, our nurses, our nurse practitioners, our doctors, our medical professionals on the front lines, our first responders. We talked as well about the folks that are on the front line, our grocery workers, our farm workers, to make sure as we were maintaining the essential nature of our economy and maintaining our aggressive stance in terms of providing the highest quality health care that we possibly could, that we needed to protect those workers. And we've been able to get out some 297 million procedure masks already that we've been able to distribute into those essential workers, into those sectors of our economy, to counties and cities large and small. And we've been able to do about 86 million masks, 85.5 million N95 masks that we've been able to distribute as well. So over the last few months, close to 300 million procedure masks have been distributed, and again, just shy of 86 million N95 masks. Today, we currently have an inventory, like what you see behind me, because of these large procurements and contracts, of 111 million units of N95 masks. We're distributing those. They come in, they come out, but currently, because of the large procurement, we have 111 million of the N95 masks and roughly 147 million units still in inventory of our procedure masks. We recognize 147 million, 111 million is not adequate still to where we need to be. And as a consequence of that, we just made a commitment to extend as a bridge contract with BYD the additional procurement of 120 million masks, 300 million masks for procedure and surgical purposes, and 120 million masks as part of our N95 procurement. So we just established a new framework to extend as a bridge contract to be able to draw down even more masks. Again, I know there's a lot of numbers, forgive me, could be confusing, but when you're burning through 46 million masks every month, you start to do the math that even having 100+ million of the N95s in inventory, you can go through those pretty quickly. Having shy of 200 million of those surgical masks, you can go through them quickly. So we need to go big and continue to be bold in our procurement And we are announcing more formally, more publicly today, this bridge contract with BYD for another 120 million and another 300 million of the surgical masks. We're also putting out what we refer to, and forgive my lexicon around the language of government, but an RFP, response for proposals, to do a larger master contract in an effort to get more bidders, to get these prices down as we're entering, we hope, into a more competitive market over the next few months. It's still not where it needs to be, and that's why we're doing this bridge contract. But as we look into September, October, November, into the new year, we anticipate it to be a lot more competitive with Honeywell, with 3M, other companies, including California-based manufacturers that will be entering into the market that can start to procure at scale the numbers that are needed to meet the needs of this state. So we're putting that information out. We want more competitive bids. We want more California-based manufacturers. And you may recall a few weeks back, I was at another facility here in the state of California announcing a partnership with our California Manufacturing and Technology Association, CMTA, where we have a Safely Making California site, Safely Making California site, which now has over 400 California-based manufacturers, providing over 435 different supply needs within the state of California. One of those manufacturers we highlighted was Avoke. Avoke is a retooled manufacturer in Santa Clara, California, that we were able to make a commitment to procure 40 million N95 masks. Those masks are coming off the production line, coming into the state inventory. Those 40 million will draw all of them down in that first phase contract by August. That's a good and encouraging sign. Again, we want California manufacturers creating California-based jobs, developing PPE for Californians, and we hope for the nation, and we should go bold and big for the rest of the world. And so that's exactly what we're encouraging. That was the commitment we made as part of that partnership with CMTA, and we're seeing fruits of that partnership, the biggest, again, being Avoke in Santa Clara. We just want to compliment their team for retooling display signs for conferences, retooling their assembly lines completely, and making these critical N95 masks at a competitive price. And we hope they are among many of the bidders, Honeywell, 3M, and others, BYD included, that all can compete to get those lower prices so that we can make some longer-term commitments. Full disclosure, we had conversations with the CEO, personal conversations, CEO of Honeywell, as an example, about opening a California-based facility and creating hundreds, if not 1,000+ jobs here in the state. That facility, we hope to encourage the development of that facility, but those units won't come online as quickly as we need them to. And again, that's the purpose of announcing this bridge contract. Let me, just for the purposes of explaining contextually what has been referred to by me and others as the Wild Wild West of procurement, looking back just 90 to 100 days ago. Let me give you a sense of where we are, at least from our perspective here in the state of California today, in terms of procurement landscape. We reached out, we want to diversify our supply chain. We reached out, as an example, to 3M-based manufacturers, Grainger, All-Star, others that are sourcing a lot of their supplies from 3M directly. Interestingly, we made a commitment, or rather 3M made a commitment to us to draw down 12.4 million N95 masks. This is not a critique, it's an observation and a proof point of where we are. We made that commitment many months ago. They made that commitment in partnership. Those 12.4 million masks, only 290,000 of those masks have been delivered. Only 290,000 of the 12.4 million. So it's a way of expressing this. While there are a lot of California and American manufacturers, they're just not providing the delivery at scale that's necessary of the moment that we're in. It's not just the moment we're in here in the state of California. I've mentioned this in the past. California has distributed over 17 million masks to neighboring states. Because of our large-scale procurement, other states competing with the federal government, competing in a global market, but also competing with other states, they're seeing similar reduction in the supply because the demand's going up, and as a consequence, their needs are great. And so Nevada and Oregon, Alaska and Arizona, those 4 states, and working with a few other states, I may have highlighted 1 or 2 of them in previous comments a few weeks ago. We have, in partnership with FEMA, who's just been spectacular, Bob Fenton. Talk about partnerships. FEMA has been spectacular partner to the state of California with their extraordinary regional leadership, and Bob Fenton helping also support our partners in other states. So I guess it's a point of pride, but it's also a point of emphasis that we decided to think outside the box. We did something big and bold, and we were able to move more boxes into warehouses like this than any other state. And we want to continue to emphasize these efforts and to magnify them even further. And that, again, long-windedly, is the purpose of the announcement here today.